Video title: The Impact of COVID-19 on Persons with Disabilities in Lebanon, Palestine, and Jordan. In 2021, researchers from the Disability Under Siege Network in Lebanon, Jordan, and the occupied Palestinian territories investigated the impact of the COVID-19 pandemic on persons with disabilities living in those countries. The aim of the research was to inform the UNPRPD analytical framework to support a multi-sectoral response to increased social, educational, economic, and health challenges arising from the pandemic, identify future and emerging research priorities and gaps, develop resilience to future challenges at individual, community, national, and global levels, informing future priorities for research collaboration between researchers and the UNPRPD. Professor Dina Kiwan, Principal Investigator, Disability Under Siege Project, University of Birmingham.
Our research found that the barriers to essential services and public spaces for people with disabilities existed before the pandemic and were not caused by the pandemic alone. However, the pandemic and associated lockdowns exacerbated the impact for people with disabilities. It's also clear that governments and local authorities didn't consult with or involve people with disabilities in their planning, failing to take account of their needs, such as making vital information and services available. The lack of formal data collected on people with disabilities during the pandemic has made it difficult to assess the impact of government COVID policies, including vaccine rollout.
Dr. Aitab Shaib, Inclusive Design Specialist and Academic Researcher, Disability Hub, Center for Lebanese Studies.
In Lebanon, the past 2 years have seen layers of challenge, including the COVID pandemic, the catastrophic port blast in August 2020, and the dire economic and political situation, with 80% of people now living below poverty line and 7% of children now in child labor, a sevenfold increase. To meaningfully respond to these compounding crises, we need to develop a long-term vision to ensure a truly inclusive response that would enable accessibility measures to be put in place before the onset of any emergency. We also need effective and accessible information sharing platforms and curricula to ensure persons with disabilities are not excluded from health messaging and schooling. Finally, people with disabilities should be prioritized for vaccination irrespective of their disability, and statistics on the numbers of persons with disabilities who contracted COVID collected.
Professor Rita Jackaman, Co-Investigator, Disability Under Siege Project, Birzeit University.
In Palestine, we have to stress the impact that ongoing Israeli military occupation has had on the ability of the Palestinian Authority to control its own land, borders, crossings, and the distribution of vital resources. Likewise, one would wish for a Palestinian government which recognizes and honors its role and duty to fulfill people's needs, especially for persons with disability, who are the lowest on the totem pole as a matter of citizens' rights derived from a social contract between state and citizens, with rights and responsibilities of each clearly defined and adhered to. In the immediate term, we call for the immediate implementation of the 2020 National Strategic Plan developed by the disability sector, but never implemented due to the financial constraints. We also need to see key provisions of the 2019 disability law, such as comprehensive health insurance and regular salaries for persons with disabilities, enacted. Other practical interventions, such as training in sign language for medical and governmental staff, and the provision of assistive devices and internet to improve access to education, would greatly reduce the impact of the pandemic.
Sabine Douaire, Research Assistant, Disability Hub, Center for Lebanese Studies.
In Jordan, we found real challenges for people with disabilities living outside Amman in accessing specialized services. However, research participants did feedback the effectiveness of the Higher Council for the Rights of Persons with Disabilities in providing accessible information and guidance on coping with COVID. Similar to other locations, we see a need to ensure better access to assistive devices and accessible curricula to support remote schooling, and a need to better prepare health workers to support people with disabilities where lockdowns limit access to health facilities.
Research title: The Impact of COVID-19 on Persons with Disabilities in Lebanon, Palestine, and Jordan. For full details for all our recommendations, please visit www.disabilityundersiege.org. The Disability Under Siege project is funded by the Arts and Humanities Research Council, Global Challenges Research Fund. Arabic Sign Language Interpreter, Ms. Naila Al-Haris. Voiceover, Yal Solan. Edited by Samer Beham. Produced by Nadine Daoud.